So what is a dermal filler and how is it different than Botox?
Sure, that's a great question. Dermal filler is something that fills out the skin, so it's for wrinkles that are due to volume loss, which typically occurs over time, or from weight loss, in fact, as well. Botox, on the other hand, is for wrinkles due to movement, what we call dynamic wrinkles. So that would be for like the forehead lines, or frown lines, or crow's feet. That's where Botox works great. Fillers would typically be in the lower face. So we would consider fillers, for example, most commonly in these laugh lines or nasolabial folds. As well, we often treat lines that develop here called marionette lines. Some people have very deep, what we call tear troughs here, or grooves. A filler would work great to plump that up, fill it out. Other people have sort of flat cheek or cheekbones, and so we can actually plump up the cheekbones very nicely. You can also use it to help define the jawline as well, or to treat some of the smoker's lines that we get around the mouth.
And there are so many different fillers on the market. From a consumer's point of view, it seems like, it's like choosing between Coke and Pepsi. So how do you know which dermal filler is right for you, and which do you typically recommend?
So there are a number of fillers on the market, and the best way to decide is with your physician, ideally a specialist such as a dermatologist or a plastic surgeon, and together you would decide what filler is best for you. We use all of the fillers, be it Juvederm, Restylane, Teosyol, or Radiesse. Those are the most commonly used fillers on the market. Juvederm and Restylane would be probably the two #1 fillers. And it depends. It depends on the age of the patient, depends how thin or thick their skin is, their experience previously with other fillers. So for example, if I was injecting the lip, I tend to prefer a softer filler. So I like Juvederm inside the lip in particular. For somebody who's older, who needs a little bit more lift or structural support, then I would think about a thicker filler like Perlane, which is related to Restylane, or even Radiesse in that case. So it really depends. I need to meet with the patient, sort of assess how deep the lines are. Are they fine little lines or deep wrinkles? Where on the face? How old is the patient? What's their previous experience with fillers?
Okay, so the fillers you mentioned are all hyaluronic acid-based fillers, which are I'm assuming the most commercially available and widely used. Is there a particular reason why that's the case?
So yes, the Restylane and Perlane, Juvederm, and Teosyol are hyaluronic acid-based fillers. Radiesse is not. It's something called calcium hydroxylapatite, so it's almost like bone. It's a much firmer filler. So for an older patient where we need real lift, that's a really nice product. So that's a little bit different. The reason the hyaluronic acid fillers have become so successful is that they're incredibly safe. They're very consistent, so they work very well, and they work similarly in different people. And then another important quality is that there's an antidote to dissolve it. So if someone had a problem with their filler, they didn't like the results, they were overfilled, for example, or the filler wasn't put into the right place, we can actually inject a substance called hyaluronidase, and it will dissolve that hyaluronic acid filler. That is not the case with Radiesse. We cannot dissolve it. There is no antidote. And there have been other fillers on the market in the past as well. Many of them no longer on the market because we never had an antidote. So if there was a problem, you were kind of stuck with the problem.
And fact or fiction, can dermal fillers actually promote skin rejuvenation?
So that's a good question. We believe that they do actually promote rejuvenation. We know in people who have had filler and for whatever reason decided to stop having treatments, they actually look better than had they never done the filler to begin with. So there is a thought, and we do have biopsy studies to show that even after you're done the filler and the filler is long gone, there seems to be about a 20% replacement of collagen that occurs in the skin, in the dermis naturally, from having injected the filler to begin with.
And is there a right or wrong time to start using filler?
There's no right or wrong time. I would say the most common age group that we treat would be 35 to 65. Certainly most commonly women, but we are treating more and more men. It depends what the area that we're treating. So for example, the tear troughs or the lips are often sort of genetically determined. And so we do treat younger people who have very thin lips or have a deep groove under their eye. And we treat people that are 25, 30 years of age sometimes for that. In other cases, some people have a deep groove at the base of their nose, and we can actually inject a filler right there to plump it up so it doesn't look like you've got sort of this large nose or a hump. So putting a bit of filler here, incredibly safe, very effective, and again, that could be in a younger person. But for sort of volume loss, for treating these areas, that would typically be in the 35-year-old plus or somebody who lost weight.
So very important question. Why see a dermatologist to get filler done? Because there seem to be a lot of places available where you can get filler done at a med spa with the assistance of a nurse or an esthetician. Is there any reason why people should stay away from that?
Yeah, that's a very good question. We do all our own fillers here, so the dermatologists here do their own fillers. We do not delegate this task to nurses or other people that are less qualified. To inject properly, you really need to know the anatomy, where the arteries are, where the nerves are. You need to understand beauty and symmetry, and you need to understand the face and how it ages. And only a dermatologist has extensive training to really understand that. There's no question that other people can inject the substance. It's not sort of rocket science to push a plunger and inject medicine, but to know what depth to inject it, to know exactly where in the dermis you want to inject it. You want somebody who's got years and years of experience. And in the off chance that there is a problem, you want somebody to be able to fix it. So we spend a lot of our day fixing the mistakes of other people out there that are injecting fillers and Botox. Unfortunately, it's not as regulated as it should be. And so we spend a large part of our day trying to fix those mistakes. And sometimes we're successful, but other times they can't be fixed. So we generally suggest do it right the first time. This is your face, this is your health, this is your beauty, and why not do it right to begin with? Sometimes we hear from people, well, I thought that it would be cheaper. It's usually the response. I thought it'd be cheaper to go to this place. And in fact, we find in many cases that the prices being charged are the same, or in fact more than what we charge. And to get it done by someone who is less qualified, who can't deal with potential side effects, or understand the patient's health and what medications they're on and blood thinners, it just doesn't make sense to go to somebody who's underqualified.